Welcome to This Explainer. Today, we're diving into something that's honestly a pretty nuanced area of clinical practice, counseling people with disabilities through grief and loss. When a client is navigating profound vulnerability, our ethical compass has to be perfectly calibrated. We want to foster true empowerment, rather than accidentally falling back on old habits of overprotection. Here is our roadmap for today. We're going to cover ethics and history, autonomy versus protection, decision-making capacity, family and paternalism, professional boundaries, and finally, mandated reporting. Let's jump right in.
All right, kicking things off with Section 1, Ethics and History. So look, ethical practice is our absolute foundation, right? But it is especially crucial here. For generations, people with disabilities have faced systemic exclusion, discrimination, and really limited autonomy. We're talking about a history of intense overprotection, where incredibly personal decisions were just made for them, completely without their input. Acknowledging this reality is exactly why providing respectful, collaborative care isn't just some best practice, it is our absolute ethical baseline.
Moving into Section 2, Autonomy versus Protection. And that history brings us straight to a really core ethical tension, which is autonomy. Autonomy isn't just some abstract concept. It's a person's fundamental right to direct their own life, who they have relationships with, what treatment they get, their personal goals. Supporting this right is the absolute core of our work, even though, as we all know, it's not always simple in practice.
We actually face this tension all the time. Imagine you have an adult client with an intellectual disability who just lost a primary caregiver. Through their grief, they are expressing this really strong desire for greater independence. But on the flip side, their remaining family members are terrified. They're deeply worried about safety and want to strictly limit the client's choices. As a counselor, you're caught right in the middle of that. You have to carefully balance the client's absolute right to autonomy against some very genuine safety considerations.
Which brings us to Section 3, Decision-Making Capacity.
Navigating that balancing act means we really have to challenge the assumptions we might unconsciously make about a client's ability to choose for themselves. First off, having a disability absolutely does not automatically mean someone lacks capacity. We literally cannot make assumptions based solely on a diagnosis. Instead, decision-making capacity, which is the ability to understand relevant info, appreciate the consequences, communicate choices, and actually participate, has to be evaluated on a totally individual, contextual basis. Because you see, capacity is not an all-or-nothing thing. Often, clients just need the right tools to engage. We're talking about things like visual supports, using simplified language, or honestly just giving extra processing time. Sometimes it involves formal supported decision-making. Providing these supports is almost always a far more ethical approach than taking the easy way out and simply transferring control of their life to somebody else.
So here is the fundamental mindset pivot every clinician needs to make. Ask yourself, how can we support this client's participation in decision-making, rather than who should make decisions for this client? Just think about that. That one shift, it completely changes the trajectory of the therapeutic relationship. It moves us away from management and straight towards true empowerment.
Okay, let's look at Section 4, Family and Paternalism.
Now, we know family members often play a massive, vital role in the lives of people with disabilities. They provide daily caregiving, emotional support, financial advocacy, you name it. And especially during grief, the family is going through their own intense stress. But despite all that heavy family involvement, the adult client still holds a fundamental right to privacy and confidentiality in their sessions. Just because a parent calls asking for an update doesn't mean we automatically share it. We always have to explore the client's preferences first and get their consent.
When we slip up on those boundaries, we risk falling right into paternalism. This happens when professionals or caregivers start making decisions for an individual simply because they assume they, quote-unquote, know what is best. And while sure, it usually comes from a place of deep care and good intentions, paternalism severely chips away at a client's dignity and their autonomy.
The tricky thing is, paternalism rarely looks malicious. It's sneaky. It creeps into practice subtly. It looks like talking to the caregiver in the waiting room instead of addressing the client directly. It's dismissing a client's preferences just because they seem a bit impractical to us. It's assuming they can't truly grasp the complex nature of grief, or limiting their options without even trying to collaborate. Ethical counseling absolutely requires collaboration, not control. We have to remember, the client is the expert on their own lived experience.
Moving on to Section 5, Professional Boundaries. Because our clients might have extensive support needs, we have to be incredibly mindful. We need to provide consistent empathy, yes, but without blurring the lines.
That means strictly avoiding becoming their primary caregiver. We should not be making decisions on their behalf unnecessarily, and we definitely shouldn't be creating relationships that blur those clear therapeutic boundaries. Keeping those boundaries firm is actually what protects both the client and the integrity of your counseling relationship.
And finally, Section 6, mandated reporting. This is a heavier topic, but it's a vital reality we have to face. People with disabilities are statistically at a significantly increased risk for abuse, neglect, exploitation, and financial manipulation. When we're working with grieving clients, who are inherently even more vulnerable, our responsibility to recognize the warning signs of unsafe living conditions or victimization is absolutely paramount. What makes this even more critical are the unique barriers these clients face when it comes to reporting harm themselves. They might have communication challenges. They might be entirely dependent on the exact caregivers who are causing the harm. There's often a very real fear of losing their daily support or the terrifying thought that the system just won't believe them. This is exactly why your vigilance as a counselor and your understanding of your state's reporting obligations is so incredibly necessary. But even when we have to navigate mandated reporting, we've got to do it respectfully. The secret here is total transparency. As clinicians, we should be openly discussing the limits of confidentiality and our reporting obligations right from the start. Telling them what steps might happen if a safety concern pops up doesn't ruin the therapeutic relationship. It actually preserves trust. It ensures the client is never blindsided and always feels respected as an active participant in their own life. Ultimately, ethical counseling is so much more than just ticking boxes on a compliance checklist. It's about honoring a person's humanity. So as we wrap up this explainer, I want to leave you with a really powerful question to reflect on for your own practice. Are you balancing safety with empowerment without removing your client's voice? Think about how you can take this collaborative framework and apply it right now, ensuring every single client you work with retains their dignity and self-determination. Thanks so much for joining me on this explainer, and keep learning.